To tell you about this disturbing development now, the Gauteng Department of Health is sounding the alarm on the rising number of infants being abandoned at their facilities. Nationally, over 1,000 babies are deserted each year. Some are dumped in fields or areas where they could go for days without someone seeing them, sometimes resulting in death. For more on this, we're joined by Yvonne Deonarain, the Director for... She is with the Department of Social Development, and she's the Director for Restorative Services and Service to Children in Gauteng. Yvonne, thank you very much for availing yourself this afternoon. Perhaps just give us a little bit of context, right? The Department of Health is sounding the alarm. To your knowledge, at least, just how desperate is the situation, and why are mothers abandoning their children?
Thank you very much for having us on your show this afternoon. You are quite correct. I think the prevalence of child abandonment is on the increase. We've just found out that when we look at the statistics, particularly for Gauteng, teenage pregnancy is on the rise. That could be one of the reasons that leads to a mother abandoning her child. I think we're currently living in an economic climate and environment that is where lots of households are experiencing lots of pressures, and you find that they are unable to afford the child and therefore are resorting to abandonment of the child. With regards to also not wanting to take responsibility, I think the sheer responsibility of taking care of a baby becomes too overwhelming for the mother or a young mother. And the easiest way to kind of get rid of the problem would be to resort to abandoning the child. We're also finding that parents of children, there's fear by young mothers to even disclose that they are pregnant, and therefore would seek to then abandon the child as opposed to now facing the responsibility or their parents' wrath when they do find out that they are pregnant. Unplanned pregnancy seems to be a big one that does always come up as a reason for abandonment. We're also finding a number of foreign nationals that do go through all the necessary prenatal care that is required, but at the time, none of the anxiety is disclosed to nursing sisters to explain their fears, their anxieties, or even to the social workers when they do visit the local hospitals. But at the time of giving birth, you find mothers just walking out of the hospital, leaving their babies to be cared for by the hospital.
So someone walks out of the hospital leaving their baby there. They would have falsified their own personal information.
Correct.
Then the Department of Health is left to care for these babies, as we understand it, sometimes for a week or a month. And then they hand them over to your department. Is that correct?
That's correct. With the Department of Health, they do have social workers within the health facility. But the social workers within the health facilities cannot do statutory intervention. What it means is you can't have a social worker from the Department of Health going to the children's court and initiating a children's court inquiry. It is only done by the Department of Social Development as well as child protection organizations. These child protection organizations are designated by ourselves, the Department of Social Development. They are designated to render statutory social work. So yes, you are correct. When the child is abandoned, the child do remain in hospital. If medical care is required, that is done. And thereafter, the child is handed over to a social worker to initiate a children's court inquiry. Now, any child that is abandoned, sometimes it may be that mom will give birth in a hospital and then walk out of the hospital. But we're also finding increasing trends of children, babies, being put into packets, dropped off in a nearby field. I know there's one NGO that even say to mothers, if you want to abandon your baby, here's a little basket, place the child in there and the child can be received. So once the child is then released from the hospital into the care of a social worker, the social worker is legally obligated to issue what we call a Form 36. Basically, the Form 36 is saying that the custodian of the child at this point in time is no longer an adult or a significant person or a family or a related person to the child, but actually a person that has been designated by law to take over the child. The Form 36 is then issued. The social worker then places the child in a temporary safe care. All temporary safe care is screened in accordance with a checklist and the specified criteria and requirements, and we have a database of such temporary safe cares. They're usually mothers that are willing to take care of such children, abandoned children. The social worker is then expected to go back to court. And when she goes back to court, she then approaches the presiding officer to indicate that the presiding officer needs to acknowledge that there is a child that is in need of care and protection. The social worker is then expected to conduct an investigation. So the presiding officer will then say to the social worker, you are hereby ordered and given 90 days, wherein which you investigate the circumstances that led to this child now being in need of care and protection in terms of the Children's Act. During that 90 days, what happens is it's quite an intensive process. The social worker, like an investigating officer, together with SAPS, would try and pick up on any clues. If the child, say, was found abandoned by a community member, the community member would be probed, questions will be asked, they'll follow up on certain leads, trying to establish if there's any relation for this child. In addition to that, as required by the Children's Act, we are also expected to advertise not the child's details, nor a picture of the child, but just circumstances around the child in local newspapers where the child was found, just allowing for us to be able to explore every possible avenue of trying to find the child's related family or significant other.
Just
during that 90
information,
days,
Yvonne, please, if you'll allow me to join you there.
Yes.
It was headline news a few weeks ago that a young woman from KwaZulu-Natal abandoned her baby in her field. She later came forward, but she also left a note, and in that note she insinuated that the system had failed her. She insinuated that social development had let her down because she did want to give the baby up for adoption. She also talked about the treatment and which is what many young women in South Africa will tell you about the treatment that they get at hospitals when they fall pregnant in terms of obstetric violence and the insults and the violence that they will face from nurses, for instance. And so could it be, while we appreciate that this will take a multi-sectoral, multi-stakeholder approach to solve the situation, you mentioned a lot of push and pull factors that contribute to babies being abandoned in South Africa, but systematically, is there anything that can be done or you feel the department could do to get us to a point where we avoid the situation where children are abandoned?
Correct. Yes. I think a lot of prevention and awareness programs do take place. And particularly there's certain periods during a year that we tend to heighten our prevention and awareness programs, particularly around teenage pregnancy, making responsible choices, effective decision-making, life skills, counseling. Particularly most recently in the last 3 years, we've now entered into a memorandum of understanding, particularly with the Gauteng Department of Education, because we find that we need to be able to target our young people, particularly in schools, so that we are able to explain to them the risk associated with sexual behavior or risky sexual behavior, what are the consequences for young women and young girls. So we're starting to intensify those kind of campaigns. Like I said, there's heightened periods during a financial year. At this point in time, the Department of Social Development, National Department, has said we have 365 days of child protection. So we are constantly driving these awareness and prevention campaigns within our various programs. Even with our gender-based violence programs, we also do touch on taking responsibility, making choices, And also, if young mothers find it overwhelming, we have a number of non-governmental organizations, non-profit organizations that the department funds, particularly focusing on counseling, life skill programs, support groups, as well as going out into communities, door to doors, just so that we are able to have a maximum reach in our communities. And yes, I think it's a worry when we see child abandonment on the increase. And I think it's about going back and educating communities, educating our young children on what are some of the responsible behaviors that they can actually undertake as opposed to getting into risky sexual behaviors.
Yvonne, very quickly for us, while child abandonment is on the increase, are we seeing child adoption following the trend? Is it also on the increase? Or what happens to these children?
Yes. Like I said, after 90 days, a social worker would make a recommendation to the court. The presiding officer will firstly find the child in need of care. So that will be a child who is found in terms of Section 50. I don't want to bore you with the legislative jargon, but just to say the child is in need of care and protection due to abandonment. The second recommendation that the presiding officer makes on is what is the alternative care placement for the child. Now, there are a number of options that is usually presented. When it's a young baby, abandoned baby, a few days old, adoption is normally one of the alternative care placements that is recommended by the social worker. Other options is foster care. And what we find, the Act has now made provision for what we call a Section 186. It basically means we can place a child with foster parents so that they can get financial support from the state up until the child turns 18 years old. And that is normally a preferred alternative care placement for abandoned babies. Adoption is the second one. A child and youth care center, which is your traditional children's home, is not an ideal placement for an abandoned baby. So that will be our least preferred placement option for babies that are abandoned.
Yvonne, thank you very much for availing yourself this afternoon. Yvonne Deonarain is the Director for Restorative Services and Service to Children in Gauteng. She's with the Department of Social Development, talking to us about the abandonment of babies. It's on the increase in South Africa, and that has been put down to teenage pregnancies being on the rise in the country, the high cost of living, and at times a lack of taking responsibility.